know that almost 1 in 5 people affected by disasters develop a mental health condition? And what do we often forget when we talk about disasters? It's not just the buildings that collapse, but minds too. We can rebuild these buildings, but what about the pain we don't often see? Disasters, conflicts, pandemics, they don't just destroy homes. They shake the very sense of safety, connection, and meaning. And mental health here becomes a silent casualty where fear, grief, trauma, anxiety are the invisible scars. That's why this year on World Mental Health Day, the theme matters more than ever: access to services, mental health in catastrophes and emergencies. When you think about it, mental health care should be the first response to a crisis. I'm not saying we should neglect physical safety. Of course, saving the life of the individual is the topmost priority. But mental health support should be equally important. Yet, too often, access collapses. No services, no trained responses, stigma, cost, distance, all standing between the pain and healing. People who need this support the most, the ones in the middle of the crisis, are often the last to receive it. Psychological distress is a natural response during this time, so access to care should not be a privilege. Of course, there are solutions: psychological first aid, community based support, telemental health, local responders training, policies that prioritize psychosocial well being. All of this exists, but they have to be made more reachable. Imagine if every emergency plan included psychological first aid. Every relief camp had a mental health professional. It is important that mental health service must be integrated into emergency response, which is essential and not optional. Also, on this day, I want to give a major shout out to all the volunteers, caregivers, counselors, and responders working on the front lines who show up every single day to hold others' pain. Just want to say that your mental health matters too. No one should have to face fear, loss, or uncertainty alone. So let's build systems that keep mental health services running even in the crisis, because healing minds is as vital as saving lives. Thank you.